Hi, my name is Susie Robinette, and today we're going to give you information on a fairly new concept called palliative care. Many people get hospice and palliative care confused. Hospice care is palliative care, but not all palliative care is hospice. They have similarities, but there are also differences. Palliative care can be provided at any time during a person's illness, even from the time of diagnosis, and it may be given during the time of curative treatment. Hospice care always provides palliative care. However, it is focused on terminally ill patients, people who no longer are seeking a cure and who are expected to live for about 6 months or less. Palliative care is not a one-size-fits-all approach. Patients have a range of diseases and respond differently to treatment options. A key benefit of palliative care is that it customizes the care for each and every person. It benefits both the patients and families. Palliative care is provided by a team of experts who collaborate on the care for the individual person. This team consists of doctors, nurses, social workers, chaplains, massage therapists, pharmacists, volunteers, and even others not mentioned. You can receive palliative care wherever you may be, your home, hospital, nursing home, or assisted living.
Hi, my name's Brady Kinman, and I was a caregiver to my husband for 2.5 years. He was diagnosed with colorectal cancer at the age of 35. He fought with courage and strength and had lost his battle at the age of 37 in 2007. I found websites that talked about palliative care and how to talk to your physicians about it. Once we became educated on this subject, we were able to ask the right questions on ways to control his pain. We used acupuncture, massage, and different pain medicines to help manage his pain. The 2.5 years was a journey through many different obstacles and achievements. We learned you have to be the one in charge of your own medical care, to not be afraid to ask for help with pain management, mental issues, or physical needs. I hope with this DVD that we can help people find the solutions that they need.
Thanks, Brady. Thanks for being here today and talking about this. What are some of the benefits you can talk about in terms of receiving palliative care from your situation?
Obviously, the main thing was quality of life and controlling the pain. And with my husband, the pain was a very big obstacle for us. And so when we were able to receive palliative care in our home, the quality of life definitely improved.
Right. How can you talk about this in terms of other people and how this helps caregivers and their families?
I think palliative care gives you peace of mind, knowing that there are options out there for the pain or for physical needs or psychological needs or even spiritual needs.
Brady, how would you go about telling patients to talk to their providers about the needs such as pain management and some of the other mental and physical needs?
I think a lot of times the patients think that they're getting all of the care that they can get, and I think it's very important for the families and the caregivers to make sure to talk to the physicians about anything that may be compromising their quality of life, and to not be scared to take control of their own medical care and to make sure that there is comfort.
Right. Really step up there and
Yes.
speak their mind and ask questions.
Because sometimes I think they think the physicians have all the answers and they're dealing with so many patients and don't have the time to know everything that the patient may be dealing with. So it is very important. And as a caregiver, you're with that person 24/7, so when they're suffering, you're suffering. And so to speak up and to make sure that you're not scared to ask the right questions.
Thanks, Brady.
Thank you,
Thanks for
Susie.
being
I
here
appreciate
today.
it.
You bet.
I'm Paul Fee. I'm a palliative care and hospice physician, a medical director of palliative care in the Hospice of Siouxland. I'm here to talk about palliative care today.
Dr. Fee, I guess let's start out with what is palliative care? How would you define it?
Susie, a simple, succinct definition: palliative care is interdisciplinary, that's team care, that focuses on the relief of suffering and improving quality of life.
When is it a good time to broach the subject of palliative care?
You know, I'm asked that a lot by my fellow physicians, and the answer is when physicians, healthcare providers, patients, or the caregivers of the patients feel that probably the focus of care, as I mentioned in the definition of palliative care, the focus of care switches from a curative disease management to a comfort care or symptom management goal, Susie.
And who is eligible for palliative care?
Any person with an advanced illness. Theoretically, we'd like to focus on palliative care earlier than later. Anyone who has an advanced illness, we care for children who are seriously ill. We care for the very elderly who are seriously ill. At our palliative care service, we say someone with an advanced problem, advanced illness who has problems that we think we could help coordinate community resources and help them.
How can physician offices and hospitals collaborate with an outpatient palliative care team?
Well, we work with our physicians. Again, I'm speaking of our palliative care program in Siouxland. We work with our attending physicians at home. They still see their patients, and they will talk to our team, our interdisciplinary team. It includes, but not excludes, nurses, social workers if they need chaplain, if they need a home health aide, and they work with those people kind of the eyes and ears. We often say that it's probably more than one person can do for comfort care at home.
And how does palliative care help patients and families?
Well, how much time do we have, Susie? They help them realize their goals of care. We establish certain things like what would you want to happen, what would you want not to happen. Our unit of care in palliative care is not only the patient but the caregiver. The caregiving issues are going to get huge. They are huge now with our aging population and the frail elderly and extended families being out of state, out of sight, that to coordinate all this care, to help these people plug in, so to speak, to community resources. Interestingly, they think of palliative care as being upstream from hospice care, that it not necessarily is at the end of life. One does not have to think about life expectancy or treatment choices. All you have to be is, it's bad enough. You have to have an advanced illness and need palliative type care. You know, if palliative care focuses on the relief of suffering, improving quality of life, and it's delivered by a team, then palliative care at the end of life is hospice care. But that's just one small chunk of what we want to do with palliative care for our aging and seriously ill people.
You mentioned the word team. Who is part of the interdisciplinary team for palliative care? Physician, and you know, I say that it sounds like there's a pecking order. There really isn't. I should probably start with CNAs, or certified nursing assistants, because you know what? They do the biggest share of the hands-on. They help bathe, they help with light housework if they are available on the particular palliative care team. The nurses' aides, the nurses, the social workers, the physicians. We have volunteers, we have chaplaincy available. That's the team care. We look at it as a holistic, with a W, holistic care that includes not only the physical, but the psychosocial, the emotional, all the aspects of care that is so necessary at this time. What would possibly be some of the barriers that patients might see receiving palliative care?
You know, I think in my experience, probably the biggest barrier in other areas, other programs, is not being aware of the availability of this. If it's available in your area, if there is someone to help. United States people don't want to talk about being bad sick. Youth and beauty reigns. They don't want to talk about, I might need care. So often they're not aware of the palliative care program. And sad to say that some of my medical colleagues also see. That I see as the biggest barrier. people still want to be, and we respect that, they want to be private, they want to be in their home, and they think, geez, here's a couple, 3 other people coming in, it's the last thing I want now. But once they see the team and how non-intrusive we try to be, we're usually accepted with open arms, very, very literally.
You talked about some of the barriers. What about the misconceptions people may have about palliative care?
Misconceptions, we have to be careful to separate palliative care from hospice. When we answer the phone, we say palliative care because a big misconception is what the H word, the hospice word. They think, oh my God, you know, that's the last, I'm going to die when I hear H, and that's when I hear hospice, and that's very distressing to people. When actually they should know that hospice, you know, we try to help people live as best as they can until they die. We're not about dying, we're about living as well as we hopefully we can help them. But to separate palliative from hospice, the concept of palliative care, that you don't have to be dying, that you have needs at home, that home health care, there's almost task-oriented, certain skills are necessary. We don't look at all those regulations. We can, so to speak, bypass those right now and go into the home kind of as we need to.
Very interesting. Thank you, Dr. Fee.
You're welcome, Susie.
My name is Cindy Rarrett. I'm a registered nurse. I'm the Executive Director of Wesley Community Hospice and Palliative Care. I've been in hospice nursing for over 20 years, and it's my passion and my love. And I'm just real happy to be here.
Welcome, Cindy, and thanks for being here. First of all, let's start out with who provides palliative care?
Well, many hospitals have inpatient palliative programs, and then the people go home, and our job is to try to keep them out of the hospital. And they have outpatient programs. Many home cares have palliative care programs. Hospices, some hospices, but not all hospices, have palliative care programs.
And you may have briefly answered this, but where is palliative care provided then?
Wherever that patient is, whether that's in an inpatient setting, a nursing home, assisted living, their own home. Wherever the patient or resident resides, that's where palliative care is provided.
And always something people are concerned about is reimbursement. So
No.
How is palliative care reimbursed?
Actually, right now, there are some insurance companies that do reimburse for palliative care. It's more of a home care benefit, but Medicare, Medicaid, there is no reimbursement. Sometimes they offer it free of charge, or there is a sliding fee scale, so there's like a monthly fee for families. But you know, we don't turn anyone away. If somebody needs the care and the support, we provide it.
Sure, that's great. Another question people may have is how palliative care is different from traditional home care, which people are probably a little more familiar with.
Right. Well, traditional home care has a lot of rules and regulations, and people have to stay home. They can't leave when they're in home care, and they have just regulations and rules that they have to follow. Whereas with palliative care, they are free to go about. It's kind of like that airplane commercial. They're free to move about the country, but they can go anywhere they want to be. And it's about quality of life. And if you make somebody follow rules and regulations a lot, it loses that quality of life and care for the patient.
Many people are familiar with hospice care.
Right.
How is palliative care really different from hospice care?
Well, I always like to say that all hospice care is palliative care, but not all palliative care is hospice. And palliative care is about symptom management and comfort, quality of life, and it's about finding out what the patient needs and trying to meet those needs and try to help them kind of shuffle through and muddle through all of the different things, and their heads are just swimming with different questions and this kind of thing, so it's a lot different.
Great, some great information, Cindy. Thank you so much. For more information on palliative care, check out these websites.